So this is my redo video for my test out. I'm opening up a sterile field. Hi Mr. Jones, my name is Tori. I'm going to be your nurse today. I'm going to be opening up a sterile field because it's been ordered by your doctor for a procedure. It's going to take about 5 minutes if that's alright with you. Thank you so much for your time. I would approach the bedside and grasp the patient's hand to view the wristband and make sure that the patient can verify his name and his date of birth, so there's 2 forms of identification. Before beginning, I would make sure that I check the patient's medical record to ensure that it's actually been ordered by the doctor. After grabbing my sterile kit, I would make sure I check the label to make sure everything hasn't been expired, but I'm going to see that it is on the medical record and that nothing is expired. So I'm ready to begin setting up for the procedure. So to begin, I would wash my hands upon entering the patient's room with soap and water. I would don clean gloves, and then I could use a cavity wipe to wipe down the entire surface of the table, including the edges. That is for universal precautions. If the patient was a C. diff or other spore patient, I would need to use a Clorox bleach wipe. And then once I do that, I need to allow it to dry completely to ensure that all the bacteria have been killed. And now I'm ready to begin opening up the package. So I would pull it off carefully, and then I can drop this from waist height onto the ground, which I just did. The label I also can drop from waist height. I would rotate this slightly so that I can pull the first flap away from me, gripping the outer 1 inch, which I assume is not sterile. I pull it out to the side, to a side, and then towards me last. This is the drape that I would use if I was doing a catheter, because I'm just opening the field. I don't actually need to use this right now, so I'm going to drop it from waist height. My gloves are what's next in the package, so I can grip beneath the drape to pull my whole field to the side to make room for that. It's not sterile there. And then I can move my gloves to open them here. The package is somewhat ripped, but I can open it like that. If a flap closed on the gloves, then it would no longer be a sterile field, so I have to make sure it's properly bent. And then I'm going to start gripping still with the outer 1 inch to make sure that I'm not breaking sterility. Okay. I want to start with my dominant hand, and I would grip on the cuff without touching any of the outer portion of the glove. I would scoop and swoop my hand in, and then for this one I want to grab it on the outer cuff, try to touch as little of the inside as possible, and repeat that motion. And then I messed up a little bit, but that's fine. I can use my sterile hand to touch the outside now to fix the glove placement. So my gloves are on. I can drop this from waist height once again, and then I would be ready to do the procedure. In order to take the gloves off, for the first one, I would begin to grip it by each finger to pull it off and loosen it a little bit, and then using my loose hand now, I would do the same with the other one. And then to take off my first glove, I would pinch near the cuff on the outside, not touching my skin because my hands may be contaminated, and pull it off, turning it inside out. And then while gripping this one, I would use my thumb of my ungloved hand, hook it underneath without touching the outer portion of the glove, and close it on the inside. And I can drop those into the trash can. And now I'm ready to close up the field. The procedure's over, and that's it.